Every year, millions of babies begin their journey inside the human body. But for millions of families, that journey begins somewhere unexpected, inside an IVF laboratory. In a place filled with microscopes, incubators, and extraordinary precision, scientists can help an egg and sperm meet, watch a tiny embryo grow over 5 remarkable days, freeze it for years, and finally return it to the womb at exactly the right moment. How is that possible? What really happens inside an IVF lab? Why do some treatments succeed while others fail? And how does a single microscopic cell become the beginning of a new life? Today, we're following the complete IVF journey, from the release of an egg to the moment a pregnancy begins. Pregnancy normally starts with ovulation. Once each month, an ovary releases a mature egg that travels into a fallopian tube. Millions of sperm begin an incredible journey, but usually only one reaches the egg. Their genetic material combines to form a new human embryo. Over the next 5 days, that embryo divides again and again until it becomes a blastocyst, a tiny sphere of more than 100 cells. If it successfully implants into the lining of the uterus, pregnancy begins. It sounds simple, but every step must happen perfectly. A healthy egg must be released, healthy sperm must reach it. Fertilization must occur. The embryo must continue developing and finally implant. If any one of these steps fails, pregnancy may not happen. This is infertility, a condition affecting around 1 in 6 couples worldwide. Sometimes the cause is blocked fallopian tubes, endometriosis, irregular ovulation, or declining egg quality. Sometimes it is a low sperm count or poor sperm movement. And sometimes every test appears normal, yet pregnancy still doesn't happen. IVF was created to overcome many of these barriers. Instead of waiting for fertilization inside the body, doctors carefully recreate the process inside a laboratory. The world's first IVF baby, Louise Brown, was born in 1978. Today, more than 10 million babies have been born through IVF, turning hope into reality for families around the world. Every IVF cycle begins with detailed fertility testing. Blood tests measure hormone levels and ovarian reserve, ultrasound checks the ovaries and uterus, and semen analysis evaluates sperm count, movement, and shape. Using these results, specialists design a treatment plan unique to each couple. Next comes ovarian stimulation. Instead of producing a single egg, fertility medications encourage multiple follicles to grow. For about 10 days, hormone injections help several eggs mature at the same time. During this period, regular ultrasound scans and blood tests allow doctors to monitor progress and adjust medication when needed. When the follicles reach the ideal size, a trigger injection completes the final stage of egg maturation. Around 36 hours later, the eggs are collected before natural ovulation occurs. During egg retrieval, a thin needle guided by ultrasound gently removes the fluid from each mature follicle while the patient is under light sedation. Inside that fluid are the eggs. Immediately, the tubes are passed into the IVF laboratory, where embryologists search for each egg under a microscope and place every healthy one into nutrient-rich culture dishes. On the same day, a semen sample is prepared. The healthiest sperm are separated from the rest. In conventional IVF, thousands of sperm are placed around each egg, allowing fertilization to happen naturally. If sperm quality is poor, doctors use ICSI, carefully injecting a single, healthy sperm directly into the egg. The fertilized eggs are placed into incubators that carefully control temperature, humidity, oxygen, and carbon dioxide to mimic conditions inside the human body. About 18 hours later comes the first important milestone, fertilization. Not every egg fertilizes, and not every embryo continues developing. Day by day, the embryos divide. 1 cell becomes 2, 2 become 4, 4 become 8. By day 4, they form a morula. By day 5, they become blastocysts, containing cells that will become the baby, and others that will form the placenta. Embryologists carefully monitor each embryo, selecting those that develop normally. In some cases, a few cells are removed for pre-implantation genetic testing, or PGT, to identify certain chromosome abnormalities or inherited genetic conditions before transfer. If the embryo is not transferred immediately, it is preserved using vitrification, an ultra-fast freezing process that prevents damaging ice crystals from forming. Stored in liquid nitrogen at nearly -196 degrees Celsius, embryos can remain safely frozen for years before being thawed for future treatment. The final medical step is embryo transfer. Guided by ultrasound, a thin catheter places the selected embryo into the uterus. The procedure usually takes only a few minutes. Then comes the hardest part, the wait. Over the next 2 weeks, the embryo must hatch from its outer shell, implant into the uterine lining, and begin communicating with the mother's body. If implantation succeeds, the body starts producing HCG, the hormone detected in pregnancy tests. For many couples, waiting for the blood test is the most emotional stage of the entire journey. If the result is positive, an ultrasound a few weeks later may reveal a tiny heartbeat. Although IVF has helped millions of families, success depends on many factors: age, egg quality, sperm quality, uterine health, and the underlying cause of infertility all influence the outcome. IVF improves the chances of pregnancy, but it cannot guarantee success. Like every medical treatment, IVF also carries risks, including ovarian hyperstimulation and multiple pregnancy, although modern treatment has greatly reduced these complications through careful monitoring and single embryo transfer. One common myth is that IVF babies are different. Decades of research show that children conceived through IVF grow and develop just like those conceived naturally. The future of IVF continues to evolve. Time-lapse incubators allow embryos to be monitored continuously. Artificial intelligence is helping embryologists identify promising embryos, while advances in freezing techniques and genetic testing continue to improve treatment. Less than 50 years ago, creating an embryo outside the human body sounded impossible. Today, it has helped millions of families welcome children they once feared they might never have. IVF is more than a medical procedure. It is a partnership between nature and science. Doctors and embryologists can guide the earliest steps, but pregnancy still depends on one extraordinary moment, when a tiny embryo finds its place inside the womb. Sometimes all science can do is give life its best possible chance. And for millions of families around the world, that chance has changed everything.